Hello, everybody. My name is Dakota Sim. I chose to do my public speaking topic on autism. I recently had my son tested when he was 2, and they couldn't get the full diagnosis, so we had to go in when he was 2.5 and get the new results, and found out that he was borderline autistic. So that's partly why I chose to do my assignment on autism. As you can see over here in the top corner, it's just a picture of side effects that could happen with autism. There's OCD, ODD, ADD, ADHD, just a bunch of small little things. The definition of autism is a neurological and developmental disorder that affects how people interact with others, communicate, learn, behave, just basically their normal day-to-day stuff. It could affect anyone. It could affect somebody that's in their 80s, or it could affect a baby. It just depends on that person. Like I said, tests could be done early as 2 years old. In this picture here, you can see that it's with the typical child's brain and a child with autism brain. As you can tell, there's more red right here than there is on this side. So there is many different courses of treatments. The current treatment of autism is just basically to reduce symptoms that interfere with daily functioning life and the quality of life. Every person is different, so meaning there's people that have very different, unique strengths and challenges. So there could be people that need many professionals that help them, or very few people. So there's behavioral, developmental, educational, social, relational, pharmaceutical, psychological, and complementary and alternative. Behavioral treatment, it's basically just applied behavioral analysis. It encourages and discourages desired behaviors to improve the variety of skills. This is basically just some of the skills that they do look for, and they always record all the data. So there's no reason that they shouldn't have what data that they need. The next one is developmental. So the most common developmental therapy for people with ASD is speech language. Speech language is there to help improve a person's understanding and the use of speech and language. There's people that communicate verbally. However, there's people that need to communicate through signs, gestures, pictures, or an electronic device. I attached a picture of some sign language because that's personally how my son likes to communicate with me, is through sign language. The next one is educational. They have a method that's called the TEACH approach, which is treatment, education of autistic and related communication handicapped children. So basically, this is just something that they go through, as you can tell in the picture. It's basically a way for them to address that student that needs help to help them thrive. The next one is social relational. Its main focus is improving social skills and building emotional bonds. They have this relationship basic model, which is also called floor time, which it basically encourages parents and therapists to follow the interest of the individual to expand opportunities for communication. Say that somebody likes somebody and they don't know how to communicate to them properly. That's where the relational comes into play. Because you have to be able to be verbal or be able to communicate and not feel like you're going to mess up with yourself. The next one's pharmaceutical. There's no medication that can treat any core symptom of ASD. There's medications to treat recurring symptoms to help people function better. For example, there's medication that can help with high energy levels, inability to focus, or self-harming behavior, such as like hitting your head up against something or hand biting. It just all depends on how they're feeling. If that parent wants to medicate them, or if that person wants to be medicated. There's also medication that can help reoccurring psychological conditions such as anxiety, depression, in addition to medical conditions of seizures, sleep problems, or stomach issues. The next one's psychological. So they have a treatment called cognitive behavior therapy. It's to help someone understand their thoughts, their feelings, and their behaviors and how they intertwine. So there's another. Here's the last treatment course of treatment that you could do, which is called a complementary and alternative treatment. It includes special diets, herbal supplements, chiropractic care if it's needed, animal therapy, arts therapy, mindfulness, and relaxation therapies. So me personally, with my son, we use arts therapy and animal care, just because we see that that's what helps him understand and stay calm when we're trying to teach him something or anything else like that. Um, The role of an OTA for autism is basically to help the child or adult with anything that they need with basic living or basic needs of living, and it's to help them get and be able to get out into the community and communicate with others, basically. How does this topic relate to occupational therapy? The goal is to improve everyday skills, which allows people to become more independent and participate in a wide range of activities. That could be them kicking a ball, or it could be them going to the mall and going shopping with friends. That kind of activity. What occupational needs are addressed through occupational therapy with this diagnosis? There's many things that could be addressed with OT with the diagnosis of autism. Some of them could be sensory, stability, and speech. I feel like the biggest one is speech because we as people need to be able to communicate with somebody some way, somehow. It's just that simple, whether it be a communication board or sign language or verbally. You just have to be able to get that communication. How does occupational therapy promote health and wellness to the individuals with the diagnosis? It helps them get out into the community. It helps them not feel like they're going to be judged for going out into the community because they have there's something special about them, and not basically feel like they have to be cooped up in their small little ball. And then, so the sites that I went to get my information was the cdc.gov for autism treatment. And then I also went to autismspeaks.org.